Good. Okay, my name is Romano. I'm third year physiotherapy, and today we are going to talk about range of motion. I'm basically going to deal with the hip range of motion. What is range of motion? Range of motion is the motion available at a series of joint or a single joint. When I say series of joint, I can mean two or more joints, but when I say single joint, it's a range of motion based on the single joint. And I'm going to base basically on the single joint of hip. And there are many different types of range of motion. There is active range of motion where a patient moves the joint himself. Then there is active assisted range of motion where there is a patient does part of the range, then the other part of the range is assisted with the therapist. There is passive range of motion where when the therapist will do the range of motion by himself, the patient will be aided, but they will be used for goniometer. I'm going to basically show the hip flexion, hip extension, hip abduction, adduction, hip medial rotation, and hip lateral rotation range of motion. Let's go. Now we are going to begin with hip flexion. Okay. After introduction and everything, you should show the question. Okay. Sorry. Okay. You will flex your hip this way. Okay. I'm going to press the goniometer. Then the mark is the fulcrum should stay at the greater trochanter femur. The movable arm should go at the midline of femur, and the stable arm should align with the midline of the pelvis. Okay, so can you please flex your hip? Okay, and when you go to lead, it is 120. So normal range of motion of hip flexion, it's 120 to 140. Thank you. Okay, in hip extension, the patient is supposed to be in prone. Same placement, the fulcrum will be at the greater trochanter of femur. Movable arm will align with the midline of femur, and the patient is going to extend the hip. From there, you go to lead. The readings it is 30. So the normal range of motion of hip extension is 18 to 30 degrees. Hip abduction. We are going to palpate for ASIS, anterior superior iliac spine. So after you palpate it, the fulcrum should stay at the one side of the ASIS, and the stable arm should align with an imaginary line to the other ASIS, and the movable arm should align with the midline of the femur. Then you are going to ask the patient to abduct the hip. The normal range of motion of hip abduction is 40 to 55. Now we are going to hip adduction, which the normal range of motion of hip adduction is 20 to 25. Same placement, the fulcrum is going to SIS, palpate for SIS, you put the fulcrum. The stable arm is going to an imaginary line of one SIS to the other SIS, and the movable arm will align with the femur. So I'm going to ask the patient to do abduction. If I see there, it's 20. So it's between the normal range of hip abduction. Hip medial and lateral rotation. Okay. Hip medial and lateral rotation, normal ranges of motion of hip medial rotation is 30 to 45 degrees, and hip lateral rotation is 32 to 50 degrees. Position of the patient should be in seated position, higher sitting position, and the fulcrum is going to be at the patella, okay, and the movable and the fixed arm, they are going to align with the tibial. Okay, the fixed arm and the movable arm will be aligned with the femur, with the tibia. I'm going to ask the patient to. Okay, here it shows 33. It's hip medial rotation 33, which is between 32 and 50 degrees. That's normal. Then I'm going to ask the patient to do medial rotation of the hip. There it is 35 degrees, which is between 30 to 45 degrees. Thank you so much.